So, good evening and welcome everyone who are joining us on Zoom once again and as well on Facebook Live, locally in Hong Kong and globally to Naveda's 80 is the new 50 webinar, sorry, webinar panel discussion, and we are on our 26th discussion today. I am Veena Dansingani, founder, director, and alopecia hair loss specialist of Naveda Integral Wellness Center in Hong Kong, which is the first value-based integral wellness center offering a transformative health experience to its clients in Hong Kong. Since the beginning of January 2021, Naveda has taken the initiative to educate people on happy, healthy, active, and purposeful living by running a campaign called 80 is the new 50. And we have been having these panel discussions without fail every Thursdays at the same time. In the month of July and August, we have taken the initiative to educate people about the Indian medicinal plants and how they can contribute to our health and well-being. Naveda has once again invited experts and scholars to share their knowledge and insights on this subject, as Naveda is committed and dedicated to bring the ancient Indian wisdom to the global platform. And we at Naveda have a full range of therapeutic Indian herbs in the form of food supplements, which can address various different forms of health concerns from insomnia, Alzheimer's, depression, anxiety, stress, joint health, heart, brain, digestive, respiratory, female and male related health issues. And which is all in a very contemporary format, which is actually allowing and suitable to the modern man, because you don't really need a lot of different sort of herbs to put together and make the concoctions yourself and make it very complicated. In fact, everything that we have is available to the modern man. So there, as we know, is so much confusion amongst people about the variety of herbs that is available and what and when are their uses and applications. So many people ask, can Ayurveda herbs be used in complementary with modern medicines? And so we have invited experts in this panel who will give us their insights and clarity about this. In today's panel discussion, Naveda will be discussing about Ashwagandha, known as the Indian winter cherry or the Indian ginseng. It is said that it is one of the most important herb of Ayurveda, used for its wide-ranging health benefits, from promoting a youthful state of physical and mental health, it de-stresses you, and also increases longevity. So we will find out from our experts if this is a fact or not. So Naveda would like to welcome our guests to the panel discussion. First, we have Dr. Pragyan Tripathi, who is the director of Narmade Ayurveda Panchkarma Center in Ujjain. And he has very kindly been with us for the last 2 weeks. And today is his third session to give us his time, his precious time to share the knowledge. Welcome, Dr. Tripathi, once again.
Thank you.
Thank you for being here. And then we have Dr. Suraj Kumbar, who is a consultant of Panchkarma from the KLE Ayurveda Hospital, Karnataka, India. Welcome again, Dr. Suraj, for being on this panel discussion. Then we have Dr. Sanjay Nagakar, who is a renowned microbiologist, a scientist, a PhD from the US. He's got a PhD from the University of Hong Kong, and he's a biotechnologist who has over 83 technologies, who has invented over 83 technologies. Last but not least, we have Mr. Lal Darinani, who is Naveda's director, and he is our 80 is the new 50 campaign ambassador. So welcome, Dr. Sanjay, and welcome, Mr. Lal, as well.
Thank you.
So thank you for being here. So let us start with Ashwagandha. So as we know, so Dr. Suraj, thank you so much for being here. Let's start with you. Please share with our audience what are some of the benefits of ashwagandha.
Yeah. Ashwagandha is one of the herb which we are using widely in Ayurveda practice. So we are using the ashwagandha in so many disorders. Mainly, we can relate this ashwagandha with the psychological disorders, like some updated research which are proving that the ashwagandha having effect on the diabetes also, and which from when we are introducing in a diabetes, it will reduces the sugar level and it will act as the antioxidant, and which is help for to relieve the stress in the diabetic, because the diabetes having which is having also because of the induced stress also we are getting the diabetes. In this case also it is acting. So in the other things like high cholesterol level, it will act to reduce the bad cholesterol which is in our body, and it is act as an antioxidant. And mainly we can correlate with the infertility. The ashwagandha having the amazing results in the infertility, like mainly in the male infertility, the ashwagandha. I think whenever you can see in a Google search, you can just scroll the type that ashwagandha, you will having get so many number of huge number of the male infertility medicines which contains the ashwagandha. So, and some of the arthritis conditions also we are using this the ashwagandha in the form of capsules or in the form of some other medicines, and in kind like neurological disorders like Parkinson's diseases, because the mainly the ashwagandha molecules acts on our neurons, and it will helps to trigger that particular nerves, and it will act on a Parkinson disease. And the some of the liver problems also we can use this ashwagandha in the form of churna. Churna, we can call it as a powder base or other capsule bases also. And in mainly stress conditions, yeah, stress conditions, we are using these um, ashwagandha, and mainly the regeneration. That is, we can call it as in Ayurveda rasayana. So in the rasayana purpose, the rasayana main thing was the regeneration. However, the anti-aging we can call it as, in that also we are using this ashwagandha in a different forms. Like in our Ayurveda, we're having the forms like we're having in a tablet form, we're having in a ghee form, we are having in the capsule form, we are having we are directly using in the powder form. So so many types, and some we are using the oil basis also. Some kind of diseases we are using this the ashwagandha as an adjuvant drug, and the another ingredient we can make it as a one formulation, and we are using some kind of the arthritic condition or some neurological condition, like in pediatrics also we are using this I quote the example bala ashwagandhadi taila. We are using the purpose of to give a strength to the particular body in a delayed milestones or the children's conditions. In that we are using this kind of the things.
I see. Wonderful. So, Dr. Trapati, would you like to add on to the benefits?
Yeah, it's really nice to hear so much about ashwagandha at a stretch by Dr. Suraj after so many times. It was really lovely. I want to tell one thing to everyone, that ashwagandha is something which has to be a part of your your vegetable garden, or could be your herbal garden in your house. If you are just taking a small pot and just putting some seeds of ashwagandha, you can order them online, then a beautiful green and very attractive plant will grow, and you can use the seeds of that plant, you can use the leaves of that plant, bark of that plant, and at the end you can definitely use the root of that plant for your health. When we are talking about this particular time, when when there are lots of COVID, post-COVID patients all over the world, and sometimes vaccinations are going on for uh, for precaution and for the management of COVID, respiratory disorders in India also, and throughout the world also, there will be so many seasonal changes in this particular, time, when one season is moving to another season, which is called as Ritu Sandhi, this 14 days period, the 7 days of previous season and the 7 days of upcoming season. For that, in that particular time also, when the immunity is going low, and there is little rain around, so there are so many flowers blooming, and there are a lot of pollens also in the air, which is making many uh, allergic patients to suffer from respiratory disorders. For all such respiratory disorders also, ashwagandha is a wonderful herb. You can use the ashwagandha. What Ayurveda suggests is, it's best can be used with milk, as we discussed about some in our previous webinars also. The kheer pak is the best preparation. Like, we have to take a glass of milk, add a glass of water to it, and if you have powder of ashwagandha, just put 1 teaspoon powder. If you have extract, then just take one capsule, open it, and put it inside that milk and water combination. Just boil it till all the water evaporates, only milk remains, and just add some sugar or some jaggery or some honey to it, and just mix it properly and just have it. The Ayurvedic literatures are also talking about ashwagandha kshar, which Sanjay sir used to say, always used to tell us and guide us, like, instead of taking the full of ashwagandha root, you can take a good extract of it. So in Ayurveda also, the very olden classical books are talking about ashwagandha kshar. They are talking about the extract of ashwagandha, that it is highly rejuvenative for your respiratory system. It is highly rejuvenative for any kind of post tubercular, post COVID, or post cough kind of, if you have lot of cough and lot of, sneezing and coughing is going on, then there will be rupture sometimes for your lungs. Ayurveda call it kshat or kshay, like that there are terms. So for that rupture also, and for that degeneration of respiratory tract, this ashwagandha extract is going to do wonders for you. It will rejuvenate your lungs, it will rejuvenate your respiratory system, and it will give you a very good and healthy breathe again. Yeah, that is how it goes.
Wonderful. And Dr. Sanjay, would you like to add anything onto this?
Yeah, as we keep hearing, everyone knows we have a tremendous health benefit of ashwagandha, and not only in India and across the world. This particular plant studied very well, the research being done on the benefit. And as we always say, like we talking about the modern research is more about like the efficacy of ashwagandha plant extract. So as Dr. Tripathi mentioned, there's a many different parts, like you can use the bark, you can use the root, like leaves, different parts is there. So that's the only difference. Like in ancient Ayurvedic literature, is basically a preparation. There's a certain kind of preparation and you apply the preparation. But in modern biotechnology, if we put the biotechnology is like we are using a lot of instrument and we try to see like how pure the molecule is. So like I always try to put my point across from day one, like science is always very dynamic, and means like you cannot use the science as a history. And this is the thing I always advise to the Ayurveda practitioners or Ayurveda doctors or even the Ayurveda policymakers, that don't use Ayurveda as a history. It is a science. What does the meaning of science? That like whatever the development keep happening, we have to keep adding on to the Ayurveda literature. But if we quote Ayurveda literature 5,000 years old and start using as it is, then it is no more a science. It is a history of Ayurveda. See, this is the two things, like, because 5,000 years back, we didn't have those instruments which can measure certain efficacy. We have those instruments today. We have the procedure, we can extract very powerful extraction. We can separate molecules. We can do so many things which we were not able to do 5,000 years back, right? So in 5,000 years back, it was a observation science that you give the ashwagandha and you see how the patient recover. So when you see the benefit, you record the benefit like, okay, give you ashwagandha and this is the preparation, and that's how the benefit is coming up. And that document like recorded and over the time become like the master document. That's what everyone educated person need to understand. But today we have a tools, right? So that is why I'm saying that I don't see like in microbiology, we have a microscope. So microscope is not a subject. Microscope is a tool which help to study the microbiology. So same today, biotechnology is not a subject or something. Biotechnology is a tool to discover more in-depth information about any biological related plant material. So if I say like, okay, if we have to go very in-depth on ashwagandha and we really want to find out and put the hybrid of, let's say, biochemistry, right? So both the doctors, like Dr. Kumbar here and Dr. Tripathi is here. We understand like there is a biochemistry. We talk about like the functional molecule. We talk about the isomers. So these kind of things. But if we don't talk about biochemistry, if we talk about only Ayurveda, then we have a limitation that, okay, this is the ashwagandha and this is the preparation, that's it. So what we are saying, no, today we have a value addition. With the latest science, we should include the new scientific information to value add the existing literature of Ayurveda. Then the Ayurveda will suddenly flourish. Then we can say this is the Ayurveda of 21st century. So this is the whole thing here. Like means you have to say that Ayurveda, what mostly like as in my opinion, people are doing mistake is people making Ayurveda as a history, not as a science, right? Yeah, and like both the doctors will agree with me because we are quoting the 5,000 years old literature, but science is very dynamic. Like one very simple example I want to give in a science, like in 1951, we discovered DNA. Okay, this is exactly 70 years. So much new information came about about DNA and genetics and molecular biology, right? If we say no, we stick to 1951, then how we justify the molecular biology? We cannot justify the molecular biology. Am I correct? Like you see, that's how it is. So science basically what happened, it adding the new information every day. So here my take on ashwagandha is ashwagandha has a tremendous track record. There's a lot of observation, lot of benefit, and by using this new science biotechnology, we can come up with the purest form of ashwagandha, which is otherwise not possible. Okay, so with using biotechnology, we can go very deep down to the purest molecule, and I think that that's where I see the future of a high potential of Ayurveda, because the medicinal properties or health wealth benefit properties are well established. There's a lot of document about it, but now we need to deep dive, like diving deep into a little bit like why, how, why ashwagandha is like. So the next question is like ashwagandha is good. Why ashwagandha is so good? So when we started asking question why, and we go studying from the biochemistry point of view, I think that's where the new hybrid model and the fascination will come. And I think that's the way where the Ayurveda can stand in the same platform like a Western medicine. Because a few days back we have seen this TV debate about like the Indian Ayurveda and the Western medicine kind of thing. And I think that that's what the Ayurveda practitioner need to understand, that if we validate the Ayurvedic properties like the herbal plant or whatever the like the recipes and or the preparation you do from the molecular biology point of view, from the biochemistry point of view, then it is equivalent to the pharmacology, right? Pharmaceutical is nothing but it is approved or tested by a certain kind of procedure, right? So I think like this is the direction I would like to inspire everyone, and even like the message to the Ayush as well, that Ayush should think on this particular direction, so the whole debate will disappear, that no, the Western medicine is superior and the Ayurveda is old kind of thing. Ayurveda can come into the level of Western medicine very easily. We are just missing one part in Ayurveda. So that's my take.
Right. Wonderful. So basically, you're saying, yeah, so we've been discussing about the benefits, what ashwagandha is good for this, ashwagandha is good for this. But yeah, you rightly said, people ask, well, what is in ashwagandha that makes it so good to sort of like, they say it's a great stress reliever, it relieves depression, it is good, sometimes it also says it improves sleep, it increases men's libido, and then it talks about it's good for hormonal balance. So what is in there that actually is doing all this? So Dr. Kumar, would you like to shed some light here?
Yes, ma'am. Actually, we can call it as Ashwagandha. Ashwagandha, the botanical name, which is goes like this, Withinia somnifera.
Yes.
So it's a from family of a Solanaceae family. So we can call it as Indian winter cherry or the Indian Ginseng. So what happened means the mainly the Ashwagandha. Why the name Ashwagandha came? Because it smells like a horse. So that's what it is called as Ashwagandha. Ashwa means horse. Yes, the smell we can call it as Gandha. So Ashwagandha that comes from that one, and which is having in modern terms, if you are seeing the chemical composition of the particular the ashwagandha, it's having the constituents like Vithnia somani, it includes the alkaloids
Yes.
and some of the steroidal lactones like vithinolides and vithiniferins and saponins. The mainly the cyto these are the compounds which are mainly acting on the nervous system.
Mm.
So that's what we can say. Whenever we are introducing the ashwagandha, it will directly act on our nervous system, and it will mainly focusing on the stress, and it will the whichever the people went for the sleep. So these kind of the activities, because of that having the chemical principles, we can call it as chemical composition, which are mainly acting on the nervous system. And because of the other chemical composition, it will directly act on the other systems like reproductive systems also. And if we are considering apart from the biochemical, actually, sir, as Dr. Sanjay sir has quoted, if we are thinking in the biochemistry way, we can consider some of the extract and we can use for the particular thing. So if we are considering in the Ayurveda way, so here we are mainly focusing on the rasa guna virya vipaka. So rasa is, we can consider that as taste. The guna is the properties of the particular plant or the whole herb, and VM is the potency we are here, the potency we are here checking, and Vipakam is the after means after the whenever we are administering the particular medicine, after that the end product we can call it as Vipaka. So by considering these all those things, it's having the kapha predominant. So whenever we are looking in our Ayurveda principles, we are mainly concentrating on Vata, Pitta, and Kapha dosha. So whenever we are introducing, it's mainly because it's having the property of the Panchamahabhutas. Panchamahabhuta, we can call it as the air, earth, and the Panchamahabhutas, Vayu, Akasha, Mahabhut, Agni. So these all the kinds which we are looking at, the Ashwagandha having the predominance of the guna of the Prithvi. So that's what we can correlate. Depending upon that properties, it will act on the nervous system, or it will act on the our reproductive system. These kind of the because of these are the chemical ingredient chemical components, or depending upon our the Ayurveda chemical composition, we can call it as Rasaguna Virya Vipaka. Depending upon their action, we are using these medicines in the relation with different kind of systems in our body.
Okay, interesting.
So I have one question here very quickly.
Yes, ma'am. Yes.
It's a very interesting question, because like in Ayurveda, like we have a classification of the bodies, right?
Yeah.
So when you do this classification like Vata, Pitta, Kapha, have you ever tried to correlate with the blood group of the people? Like, did you find like a certain blood group people fall within certain group of the Ayurveda, or it is random?
No, sir. Actually, yeah, it's a nice, good point from you that we need to update. We have to do the research on according to the blood group. Actually, we don't have, actually, I don't have any idea regarding this, but it's a
Mhm,
good point to take the research work on the particular aspect.
mhm.
Surely, I'll consider your point, and in future we will look on this issue,
Because
and we'll
it's
try.
make a
Yeah.
sense like here
Yes, sir.
when
Yes.
we have a
Yeah.
classification, maybe like because like see other way, like when we are learning more about India's shlokas and other things like that, we are saying like, wow, the so much information is hiding inside our shlokas, right? So who
Yes. Yes.
knows like this we say this vat pit kapha like in such a simple way, but it may have such a very deep scientific meaning, and it cover all the modern aspect of different kind of blood groups and different kind of things. So it's a very interesting point to know about here.
Sure, sir. Sure, sure.
Yeah,
We will
good.
look on this, and we'll do.
Thank you.
Definitely, we'll do on.
Yes. So Dr. Tripathi is coming back in a few minutes. He's just got something urgent to handle. But yeah, so talking about the biochemistry. So yeah, Dr. Sanjay, could you elaborate a little bit more about what Dr. Kumbar said about the chemicals that he was mentioning to the audience?
See, basically, Dr. Kumbhar and I, we are saying the same thing. It's just the language is different.
Hmm.
Right. I'm using the language of a modern science, biochemistry, biotechnology, and Dr. Kumbar is using the language of Ayurveda science, right? But at the end of the day, the message is the same from both sides, right? For example, Dr. Kumbar mentioned alkaloids, saponin. So same thing we do. Like it's like at the end of the day, it's like saponin or alkaloid. What is happening from the public point of view, public only talk about nutrition. So if they don't hear something about vitamins, minerals, and protein and fat, they think like they don't go beyond that. Now for a normal public, now people getting aware, but suddenly saponins, for example, right? So technically in our language we call it bioactive substances. We don't call it nutrient, but people start calling nutrient as well, right? But we get bioactive compounds. It has a certain kind of therapeutic benefit. So the Rasayan Pravatti, like what Dr. Kumbar said, like in Ayurveda, that's the same thing. It's just the vocabulary is different. But now the good thing, what is the good thing? What is the positive thing? This Ayurveda is no more, and that is my main message. That Ayurveda is no more like this old ancient literature what many people talk. So we have both the doctors here, though are formally educated and qualified doctors, so they have gone through a proper medical education. Okay, so that is the difference. When you hear from Dr. Tripathi and Dr. Kumba, you will get Ayurveda's different perspective as compared to the person who is passionately interested in Ayurveda and did some diploma and started doing the Ayurveda practice. So these people will tell you only the limited information what they can read. Whereas Dr. Kumbar and Dr. Tripathi can tell you exactly very much detail, which is very close to or almost is a medical science, right? Because their education system is again is the 4 year 5 year system. Is not like 1 year you pass a Ayurveda you get a Ayurveda degree in 1 year. So this is the most important thing people need to understand, that Ayurveda doctors are not this 1 year or 2 years graduate. They are the same people who go through the same rigorous qualification as the MBBS student goes. So am I correct, Dr. Kumbar, on that?
Yes, sir. Actually, in Indian government, we're having the BAMS. We can call it as Bachelor of Ayurvedic Medicine
Yes.
and Surgery. It's a 4.5 year the course and 1 year internship. Totally, it is a 5.5 years, like MBBS, which have we having the MBBS also same 4.5 years plus 1 year internship. After getting this undergraduation, we're having different 21 specialties in Ayurveda and some of the diploma courses like a 2 year diploma, post-graduation diploma courses also.
Yeah.
And mainly the MD post-graduation, we're having the different branches which we are studying. Like if we are going through the MBBS system, we're having the professors like anatomy, physiology, and like that MD in anatomy. It's the same thing in our Ayurveda we're having. The just the naming is different. Like MD, we can call it as anatomy in the MBBS. Here we can call it as MD in Sharira Rachana. For a physiology, we can call it as MD in Kriya Sharira. So for Dravya Guna, we can call it as a pharmacology in modern perspective. Here we can call it as MD in Dravya Guna in Ayurveda. So like that, so many other things. So we can, if we are seeing the proper channel, the MBBS, the education is also same, and the just the terminology and the way of approach and the pharmacology different. But everything because the our lastly our human body is the same.
Same.
So whenever we are going to the study, our bones is same. We having everyone having a both two eyes, one mouth, and two nostrils, 2 ears. Everything was the same. The same anatomy, the same physiology, the same the biochemistry. We can call it as same thing. Just here we are learning in a Ayurvedic method way, and there we are ready. They are doing with that thing. So this was the difference. Just we have to see because nowadays what happened. I think. In a western also western countries they will come to India for some cottage or something they will go on studying with yoga or some courses they are taking with the Ayurveda and they go on starting they are treating as a wellness treater Ayurveda
Exactly.
expert and other things they are practicing. So I think this kind has to be stopped because
Exactly.
in our Ayurveda we're having a science because Ayurveda the word only says that Ayu and Veda. So Ayu means here the life and the Veda means the knowledge, the which tells about the knowledge of a life. So we can call it as Jiva Vigyan. So
Mm.
in relation.
Yeah.
So life science. So that's what we need to stop these all the kind of diplomas and other things because we have to think in
Yes.
the broader aspect, not a narrow aspect, like only
Yes.
the nutritional or a diet aspects. These words I want to suggest.
Yeah, I mean, I agree because ultimately it's a big responsibility when somebody comes to you with a health condition, and if you don't have thorough, deep knowledge in this subject, and you're just treating like that, it's actually irresponsible. You're actually taking care of somebody in a very irresponsible manner. So,
So what happened, Veena, here, the main message is Ayurveda is itself is a perfect science, right? But you need a proper Ayurveda practitioners who gone through the proper Ayurvedic education. So this is true that Dr. Kumar is saying very much, and we know all around the world there are like a fashion, the Ayurveda fashion is going on. So people are running the spa, this, that, and they become expert, but they are not gone through the proper training. So they have no idea. So basically, like if you have like a 2 months diploma or 6 month diploma kind of things, you cannot serve the patient what Dr. Kumbar or Dr. Tripathi can serve. So that's where we need to have a big shift, and this is the important part of this particular discussion. So though we are talking about ashwagandha, but then we have to see like ashwagandha from the Ayurvedic doctor's perspective and ashwagandha from the Ayurveda passionate perspective is a two big difference, right? I'm putting my scientific thing is a different thing. Is different. It's a validation. Basically, you can say it's a validation. But we do not reject because it's again a branch of science which which are working with evidence. But where we are lacking, that there are so many what you call a celebrity practitioners, they become very popular among the people because they have like a good like speaking ability. They are like they are very active on social media, they are have a Instagram followers and all those kind of, they basically actually very honestly damaging, destroying the very powerful root of Ayurveda. Okay, so that what people need to understand, that they can be a spokesperson or they can have like a entertainment talk, they can have an entertainment talk like for a knowledge point of view if someone want to hear, but if you want to hear from the therapeutic point of view or the patient point of view, then I think there has to be do's and don'ts. And do's is like that there has to be strictly Ayurveda practitioner who went through the BMMS degree, and then whether further like have the same like equivalent MD or post graduation diploma, something like that. So this is the selection, and this is my message to the audience. Like when you see some Ayurveda practitioner, please make sure that who is your doctor, right? So yeah, I think like it's very important to see who is the doctor. Yeah. So
Yes.
here Tripathi ji is back. Dr. Tripathi. Yeah.
Dr. Tripathi, how are you?
Yeah, I'm good.
All okay?
Yeah, done.
Wonderful. So we were just having a wonderful discussion on first of all, just before you left, we were asking about, yes, we all know about the good health benefits, but why? Why? What is inside ashwagandha that is giving so much benefit to neurological disorders, sleep, or mental disorders, or for known for relieving stress, anxiety, depression. It can be a rejuvenating factor. So we were trying to understand from Dr. Kumbar and Dr. Sanjay what is inside ashwagandha that is, so it's so powerful in so many ways. Would you
True.
like to share your input?
Yeah, definitely. Recently, one of my friend did PhD in a role of ashwagandha in diabetic neuropathy and retinopathy. So what he find out was, he told me very superficially that there is a DNA strand. In DNA strand, there are sugar, protein, like that molecules are there. And in diabetic neuropathy cases, that sugar protein becomes only sugar. That sugar actually overlaps the protein molecule, and the whole DNA starts becoming a sugar DNA. In that case, actually the impulse which is supposed which brain is supposed to receive as a result of any kind of hit or any kind of injury or any kind of bite, like if there is a leg toe, the big toe got injured and brain has to repair it or heal it, then the signal should go properly. But in diabetic neuropathy cases, brain won't receive the signal properly. That's why there is very prolonged healing and very prolonged recovery of the wound. So what he found out in his PhD is, when we are giving ashwagandha sheer path, when we are giving ashwagandha with cow's milk for like something around 90 days, the result of that is the sugar strand which has covered the in between protein also, that ashwagandha actually helps to push off the sugar strand to be in its own limit, and it clears off the track of protein uh, which is present in DNA, and that is how it heals the diabetic neuropathy and retinopathy completely. And for further deposition of sugar uh, in the DNA is also highly inhibited by the long use of ashwagandha. So when we are talking about diabetic neuropathy and retinopathy cases, which are the further degenerative changes of diabetes mellitus, so ashwagandha has been proved a highly efficacious, highly potent drug, not only to enhance or stimulate the activity of pancreas to secrete insulin, the iris of Langerhans beta cells and all, it also makes uh, cells, the cell wall to absorb the insulin, that osmosis, that osmosis thing, which is like the uh, entrance of insulin inside the cell, that is also stimulated by ashwagandha. And further moving in diabetic neuropathy cases, at the nerve ending level also, ashwagandha tries to rejuvenate as much as it is possible. Yeah, that is how it goes.
So, Dr. Tripathi, there's a question like this: PhD is done on an animal model, or the sample was done on the human?
Earlier they have done it on rats, I think, and
Okay,
then further they have seen that in human beings also. It's Dr. Nadeem from Riva.
okay,
Yeah.
okay. Good, good to know.
Wonderful. So, yes, so maybe we would like to now understand a little bit more about certain recipes that a common person can make at home. So it's more available to everybody. So possibly can somebody like Dr. Kumar or Dr. Tripathi share some recipes that which can be used or made at home to maybe if we take it. First of all, can someone take it on a daily basis? Is it only applicable for male or also females can take it? If it's is there any particular good time, morning time, night time to take it? Can we take it for the rest of our life? So these kind of things, maybe we can clear.
Yeah.
Yeah, Dr.
The
Kumar.
we Yeah, it can be, we can use, if we are using the ashwagandha, we can use like herbal tea. So everyone now fascinated with the herbal tea. So we can like, just we have to use the 1 teaspoon of this, the root powder, which is available in a market. And that in that we have to add 1 cup of water and we have to boil for 3 to 5 minutes. And we have to filter it and we can use like a 50 ml or a 40 ml dosage for its adult dosage. It's not for only male and a female. The both genders we can use this one. So if it is related with other things like some of the diseases like some infertility or stress, other things, in that condition what we have to do, we have to take a 1 teaspoon of the ashwagandha, and in that we have to add 50 ml of milk, and we have to add 120 ml of water. Just we have to start boiling. After it reducing the half of the portion, we can use it as ashwagandha kshirapaka. If we want, we can add some amount of a jaggery or a sugar in that, and just we have to use. So it is before means it we have to use the kshirapaka before the food, or we can call it as empty stomach. So we have to use, if the stress related or insomnia condition, we can use at the bedtime. So so the mainly the people having the habit of having a milk at the night before going to bed, that time also we can use this ashwagandha shirapaka for the better sleep purpose. Because the insomnia will in the conditions like insomnia, it will act as a good. And some in some condition we can use with the honey also. Just we have to mix with the honey, and just we are using the like a licking purpose. So mainly I will here point of view. So ashwagandha having the two properties, the two major properties depending upon the administration. One is, if you are using with the honey, it will cause other effect. If you are using with the milk, it will having other effect. Like if you're using with the milk, it will increase your weight. If you're using with the honey, it will decrease your weight. This is the main thing. So I think after knowing this, everyone start having the ashwagandha, and they cannot blame us. So that's what I want to say here. So if you're using with the honey, it will reduce your weight. If you're using with the milk, it will increase your weight. This was the thing. Yeah, Tripathi sir, can you highlight on other points?
Yes.
Yeah, definitely. If Sanjay sir is not having any question, then I'll proceed.
No, no, it's fine. It's fine. It's great. Please
Yeah,
proceed.
yeah. Okay. So, talking about the tasty and wonderful preparations of ashwagandha, let me start with a very wonderful thing which I have prepared at my clinic. It is called as chocolate. It is a chocolate prepared out of ashwagandha. Okay. So let me show it, because it is a very yummy preparation, and it is basically prepared out of ashwagandha. So this is a wonderful thing which we can prepare, everybody can prepare at home out of ashwagandha, and it's really very yummy. Yeah. so,
So,
so
So this chocolate is prepared at home?
Yeah, definitely. We have just brought some chocolate powder and we have added ashwagandha extract, the same which Mr. Lal was showing in the beginning, the box of ashwagandha extract capsule.
Yes.
That same thing, we have to take a capsule, we have to open it, and we can just add it just like any kind of granules we are adding in milk, like some Bonvita, Horlicks, or something like that, or chocolate powder. Just like that, we have to make people to start adding ashwagandha also. Let it be extract or powder, or you can prepare granules out of it. How you can prepare granule is, you have to prepare a decoction of ashwagandha, like just say take 1 liter of water, add 1 teaspoon of ashwagandha powder to it, reduce it to 1/4, filter it, then add sugar to it, and keep churning till it becomes little solidified, viscous. And in that condition, still you have to keep the flame high, and you keep churning it. It will become like granules, just like ashwagandha will become ashwagandha Bonvita or Horlicks or something like that. Yeah, ashwagandha granules we'll get, and it is 100% dissolvable in milk also and in water also. So we can prepare tasty granules of ashwagandha. We can prepare chocolate of ashwagandha. You if you are preparing any sweets, okay, or any cakes also, then you can add that ashwagandha in that cake also. Nowadays, we are working with some bakers, and we are preparing ashwagandha cookies. Okay, and we are preparing ashwagandha chocolate. I have shown already. So like that, after this or during this COVID period, everybody was very much cautious about immunity enhancement. And for that, this gilo, as we talked earlier, this neem, turmeric, amla, and ashwagandha, these were the like very famous and very favorite herbs all around the world, I think. So apart from this, if you want to get maximum benefit out of ashwagandha, like starting from head to toe, if you want your hairs to be very beautiful and very shiny, just like Mr. Lal, and if you want your brain and your nervous system work very properly, if you want your eye vision, your all your indriyas, all your sense organs, like the the inhalation, the hearing, the talking, the taste, the skin texture, digestion, metabolism, breathing, genitourinary tract, uh, basic metabolism, hunger, appetite, urine. See, if we really want to make the people who are in 80s to to make their body U-turn and come back to 50, then ashwagandha is definitely going to be a wonderful U-turn, accelerator, we can say, because after 50, people will be having some urinary problems, prostate problems, and digestion issues, constipations. For all such things, we need a perfect rejuvenator. We need a perfect immunity booster. We need a perfect aphrodisiac thing to stimulate all your nerves, to get you very enthusiastic throughout the day. And all these properties are well equipped in ashwagandha, so we can use it almost all the forms. I don't remember, after my like so 15 to 18 years of experience, I did not remember, I did not recall, I'm not able to recall anything with which ashwagandha cannot be taken. Yeah, so ashwagandha can be taken with almost all the food items, and there is no any contraindication of ashwagandha, or no restrictions or no rules which are supposed to be followed by while taking a medicine. So it can be taken as a food supplement, it can be taken as a wonderful rejuvenating medicine also. Yeah.
So it sounds very much like an amla.
Yeah, yeah.
Yes,
Very
exactly.
true. Very true.
So, Dr. Tripathi, very a layman language question for the audience.
Sir.
It looks like as we progress, like Veena said perfectly, like amla, right? It was a superfood kind of thing. Now ashwagandha like thing. It looks like in India we have a Gujarati thali or Marathi thali or this
True.
thali, that thali. You replace that thali and looks like to me like you in the one, like you put the ashwagandha, you put the amla. So what are the other things you are telling us that we can consume uh, on a daily basis, whether irrespective of our health? Because like what I'm guessing, the message I'm getting over here, last discussion you talk about amla, you talk few things like obviously immunity, eye health. Today again you talking about the, like for the retinopathy from diabetic point of view, but you talk about the immune system like that. So like this all sounds so magical. So why we Indians or even the worlds are still not paying so much attention to such a great and wonderful stuff?
See, that's a very, very important point you have put forward, Sanjay sir. I have a patient from UK, and she told me few days back that there are some hospitals opened there, which are treating just insomnia. Yeah, for sleep, for inducing sleep, they have opened some hospitals. Okay, and she told that there are so many parts of the world where they are opening hospitals just to induce good sleep. So when we are talking about mental relaxation, as Dr. Suraj sir also has mentioned earlier, when we are talking about mental relaxation, when each and every doctor of the world is just telling to the patient that whatever disease you have, let it be diabetes, let it be hypertension, let it be cancer, let it be insomnia, let it be depression, all your disorders are just because of stress. Stress is the only reason, because patient is telling, I'm taking a good diet, I'm buying very good fruits, I'm buying the costliest herbs, we I'm drinking the best quality of milk, I'm taking best quality of meat and everything. Still, doctor, why I am falling ill? Because, and then the doctor is straightforward, he's saying that stress is the only reason, and the patient is 100% convinced, yeah, definitely. I have a lot of stress. This is stress was always there. Yeah, we used to have, the humanity used to have wars from right from the beginning of human race. So there are always stress factors, and even today there are lots of stress factors are there. Everybody, for everybody, even the students, professionals, old age, for everybody there is lot of stress. And ashwagandha is such a wonderful thing. See, for inducing sleep, there has to be something which is intoxicating, right? Something like some alkaloids extracted from some weeds or tobacco, or afim, ganja, or something like that. That is what even the
Yes,
allopathy pharmaceuticals are extracting from the natural
yes,
herbs and giving to the patient. They are basically sedatives. They make you sleep, and that is not the natural sleep, right? That is some kind of intoxication you will be suffering from, you will be feeling. But ashwagandha is such a wonderful herb. It is not having any kind, it is devoid of all sorts of toxicity. No nasha kind of thing, no any kind of like sedation kind of thing. But still, ashwagandha is wonderful sleep inducer. You just take one capsule of ashwagandha with milk, and you'll sleep like never before. That much mental relaxation uh, it will get you happen. And that much thoughtless sleep you will be having, that kind of. And early morning, if when you are getting up, you will be completely relaxed and completely energetic. Your brain is 100% prepared to work even much more than what you have done earlier. So that kind of rejuvenation, that kind of enthusiasm, and that kind of stress relieving capacity, ashwagandha is uncomparable herb with any kind of sleep inducers all over the world. Yeah.
so now like from both the doctors, like the party, Dr. Tripathi and Dr. Suraj, this is making like the things, the discussion more interesting, and I'm getting a little bit greedy, and so does the audience. Now we discussed in the previous webinar, okay, at night, or like we know that like a milk is a good sleep inducer kind of things, and we have this cultural habit in India to drink milk and sleep. And when this COVID came, so like a lot of talks like, okay, put some turmeric into milk and then drink like this hot milk with turmeric, or like sleep, and then you add like put a little bit honey into it. Then you talk about the amla into it, and like means then like today we are talking about ashwagandha. So that's the question: can a normal person use a cup of hot milk at night by putting a little bit honey into it, by putting like a little bit of ashwagandha, little bit like extract of ashwagandha, little bit extract of amla, and little bit extract of turmeric? Will this work, or it has a contradiction to each other? Can we talk about it the super combination, or it is a contradiction?
Yeah, we can add with the ashwagandha and amla. I think yeah, turmeric also, because recently we did the one preparation for the immunity booster for this in COVID situation,
Hmm,
which is the combination of the ashwagandha,
hmm.
amlaki, we can call it as amla, and the haridra, we can call it as turmeric.
Okay, yeah.
These are the and ST Madhu, that Glycyrrhizia glabra can
Hmm,
consider. So we can made the combination and we made the granule and we started giving to the patients. So by the time
wow.
we can use this type of a combination, it worked good. So this combination we already use it for the so many patients for as a immunity booster in a COVID situation. Yeah, it works and it will give a wonder results.
So it's very nice. So like you already tested as an immunity booster, and what we are hearing from Dr. Tripathi right now, because it's like a sleep inducer, so you
Yeah.
can get a good sleep. And then you already talk about the amla benefit, and Veena and I, like we were discussing today, we picked up something like you said, it's good for eyes, right?
Yes.
Beside like all so many properties, like good for eyes. So I can see a multiple benefit. So it's not only the immune thing, but like okay, you can get a good eye health, you can get like good like a brain health, like many multiple benefit, isn't it?
Having it's having a
True.
multiple beneficial for almost all the symptoms which are in our body. So actually startingly only I have pointed towards the specific diseases like diabetes, cholesterol level,
Hmm,
Parkinson's,
hmm.
or reproductive system. Means if you are considering this point of the ashwagandha, it is having the point to point effect on almost all the symptoms of our body. So
Okay.
because the main culprit of almost all the diseases in our Ayurveda says Vyadhi, so we can call it as disease for the Vyadhi. So almost the stress. The stress is the main thing. The whenever the stress will reduces, the almost all the diseases will went off, because we are living in the modern era, and this is the very busiest and the stressiest life in the situation. So best thing is that we can consume it at the daily ashwagandha basis, like in the herbal tea or other type of basis, or we can make it the kshira paka. It will definitely beneficial to every individual.
So another connected question for the audience. uh, as you mentioned in Ayurveda, stress is like the key. So with your practice, like both of you are doing practice for quite a some time, have you ever noticed your patient when you like really deal with, doesn't matter what kind of like illness they have, but when you treat their stress level, can you see the regression of their illness?
Definitely, sir. Definitely, we are seeing
Yeah.
the yeah, because so many. Actually, I will quote you the some other diseases like a lumbar disc bulge. I think you
Hmm.
know the disc bulge, and some of the other neurological cases also. If you are just we are relieving the stress, they will happy with they are means they will feel like the pain will relieve from their complete body. So
Okay.
this is the main trigger point, where the stress is the trigger point for almost all the diseases. So first thing is just, so that's what in our practice also, whenever we are making the combination of the medicines for the particular patient, just we are adding some of the dravyas like the rasayana, ashwagandha,
Ashwagandha.
or other medicines also we are adding and we are giving to the patient.
Okay.
So that will the key point.
Okay. Very good. Dr. Tripathi,
Yeah.
your say something on this.
Yes, yes. Actually, when we are considering the treatment of very just born babies, And when we are talking about the treatment of very old people, not as young as 80, but as old as 100. Yeah. So, Mr. Lal should not feel like, okay, yeah. So starting from the newborn babies treatment for energy boosting, for metabolism stimulation, for, for proper growth and development of a newborn baby, for the digestion, metabolism, and very good hormonal secretions and endocrine health of an adult, proceeding further for producing very healthy kids. Yeah, when a couple is going to indulge for producing a very healthy progeny, moving further in 40s or 50s, early 50s, when menopause is going to occur and lots of osteoporotic changes and bone density will be like coming down for ladies, when lots of hormones are just getting themselves withdrawn in menopausal phase. Moving further, when we are crossing 60s and 70s, and people will be having lots of constipation and, indigestion, and uncontrolled thoughts and insomnia and lots of coughing kind of disorders. Moving further, when you are crossing 80s and your eye vision is really deteriorating, your hands are shivering, and there is a stunt in your heart, and there is a high cholesterol level, and there are diet restrictions for you to combat even that thing. And if you are suffering from any kind of serious disorders, like starting from diabetes, arthritis, stiffness of the joint, stiffness of the muscles, blood circulation is hampered some or the other way, your brain is not working properly, there is some clot kind of thing in your brain somewhere, and you have some kind of uterine fibroids and all developed inside your womb. For all such things, the first drug of choice is ashwagandha. And
Very interesting.
whatever be the most acceptable, palatable uh, food you have, like for just born babies, you can give ashwagandha with mother's milk. Moving further, you can give it with honey. Moving further, boiled with milk. Moving further, with ghee. Moving further, you can add in the dough and prepare chapati or cake or whatever you want to do. Moving further, you can prepare it in chocolates or something, or with any kind of granules. You can use it as a food, as a medicine, as a drink. If you have a habit of taking something like, a wine, red wine or something, you can add ashwagandha extract or powder to that also, because we have very good ashwagandha. Ashwagandha is something which is having very wonderful results, even when it is used as, alcohol kind of preparations, like we have ashwagandha rist and all that. So it is working wonderfully with water, with milk, with drink, hot, cold, in all the possible ways. Yeah.
Very good.
So
Very informative.
I have a question, because again, same thing. When there is somebody who's a heart patient and is taking lots of medication, can they take ashwagandha? Because will it affect, or will it lower their blood pressure, or something happens?
Definitely, ma'am. Sure, it will act on for helping for lowering the blood pressure. So it's not like that. If you are using the Western medicine we are using, you can use this ashwagandha with modern medicine, like Western medicine also.
So no herb drug interaction here, right?
No, sir. No, no, sir. No.
Good.
I mean, why I like to ask this is because well, my mother is a heart patient, so she's taking a lot of medication, and she had some experience of while she took ashwagandha, somehow she felt very, uh, she felt her blood pressure drop, and she said she started sweating. So then, so she kind of felt
Yeah.
maybe she should not
Then
have it together.
Yes. Actually, then she needs she has to lower the dosage of that hypertensive medicines. She has to, yeah, because if she is taking the 50 mg of the particular medicine, she has to reduce that half amount of that particular dosage. So initially what happens means, in our practice, whenever we are prescribing a medicine, we will start initially with the western medicine and ayurveda medicine, then similar way. When these kind of interaction will happen with the patients, just we will that reduce that western medicine dosage into the half. So slowly, whenever the patient is getting beneficial with our Ayurvedic medicines, just we will stop complete Western medicines. So this kind of a thing we are practicing. So that's what, whenever you are taking as a medicine, just you have to consult the particular the physician with the Ayurveda or whichever the Western medicine. Then only you can take the whichever the form of Ashwagandha or whatever it is.
So it does have this tendency to lower your blood pressure.
Yes, ma'am. Yes.
That's very good. This discussion is getting a little bit exciting. Like, means it a related question, Dr. Kumbar. Um, you mentioned about that anti-stress, right?
Yes.
Effect of ashwagandha, and like we measure, like in the Western medicine, usually we people measure the cortisol level
Yes.
to
Yeah.
see, like it's like the stress hormone, right? So usually whenever in the Western medicine they measure the cortisol, they ask you to withdraw from all the blood pressure medications because it can mask
Yes.
the result of the
The result
cortisol
of that
and some
cortisol.
other
Yes.
kind of hormones like there.
Yes.
So if person is taking ashwagandha, uh, it will not have any effect. What I understand so far, it will not have any effect on cortisol testing, right?
Yes, sir. Yes.
Okay,
Yes.
very good. This is very important information for people to know. I think like people should know these kind of information a lot because it will really help them. And as Veena asked this question, there are so many people and then they get scared. So when they get scared, what they do, they stop so in this case, what happened, like the people will stop ashwagandha and continue the Western medication.
Yes,
But
sir.
you
Yes.
said like a very interesting point, like,
Yeah.
okay, if you
Yeah, because
understand little
that's what
bit,
I told you, sir.
yeah,
Whenever you are taking the particular, means these advices, you have to take it with a particular registered doctors or
yes,
whichever the clinician or the physicians of Ayurveda.
yes,
Not with,
yes,
because what happened, I have told you previously that the diploma and other things, they will having a little bit knowledge about the drugs interactions. So if you having a thorough knowledge to that particular doctor, then you will understand when we have to stop and when we have to start.
exactly.
And
Wonderful, wonderful.
people who already have a low BP, what about them? They actually, their own health, they always have low BP. Then what to do? Can they take?
See,
Yeah,
see,
Tripathi, sir. You can.
yeah, see, ashwagandha is something which we are giving even for the low BP patients, and this is something which we are giving for hypertensive patients also, but with different supportive drink. Okay, if you are having low BP, then you need to get your nerves excited, or the that nervous stimulation has to be done. And ashwagandha is wonderful nervine stimulator also, when it is giving with given as a kheer pak, boiled in milk and given. Okay, then it is going to increase your, it's, let's not say exactly blood pressure, but the all the signs and symptoms which you are going to feel with low BP, that low energy level, the thoughts are also making you go down, there are repeated thoughts, you are feeling very tired and exhausted. All those signs and symptoms will be subsided by taking ashwagandha boiled with milk. And if you are having high blood pressure, definitely it is very good mental relaxant also, but with a different cold drink. Yeah, and that particular code drink is always decided by studying the reasons, different reasons behind low BP and high BP. Yeah, so ashwagandha is something which is actually, known for correcting and maintaining your blood pressure at a optimum level. It is not known to increase your blood pressure or decrease your blood pressure, but it will give a perfect, blood pumping capacity for all the muscles of your arteries and veins to maintain a very good and healthy level of blood pressure for your body. Yeah, this is how it works.
So, Dr. Tripathi, since you like, because like, obviously today's topic is ashwagandha, and
Yeah.
we are talking about the benefit of ashwagandha on a blood pressure side, and as we all know, Arjuna is one of the best, well-known, well-established Ayurvedic preparation for heart disease, like heart muscle kind of thing.
True.
So, what is the beautiful combination of Ashwagandha and Arjuna? Will really you guys refer to your patient when they are coming with the heart condition?
Definitely. See, when we are talking about Ashwagandha and Arjuna, they both are very, very effective herbs for all the cardiac disorders. Okay. We are even giving Ashwagandha and Arjuna kind of herbs when when the walls of the heart are not working properly, when
Yeah.
the pumping in the heart is not proper, even when some arteries or some veins are having some kind of protein or something else blockages inside that cardiac vascular system. For all such things, we are definitely and we can definitely give ashwagandha and arjuna in equal quantity also, but they both are, astringent taste. So for stimulating the digestive system to get both these herbs digested properly in your stomach, and to stimulate the body to extract all the active alkaloids inside the circulation, and to make it reach the perfect site where the operation has to be done, yeah, where the effect has to be seen. We need to add some, what we call in ayurveda, deepana pachana dravyas, like something which will stimulate the digestion of ashwagandha and arjuna and even help for the circulation. So the best and easily available thing is dry ginger powder. Yeah,
Okay.
dry ginger, one pinch has to be added while preparing the, milk decoction of arjuna and ashwagandha. So the possible combination, good combination could be arjuna one part, half to that we can take ashwagandha, because what we more want in cardiac cases is arjuna. Yeah, ashwagandha is a secondary drug when we are talking about just heart. Okay, so we will take one part of Arjuna, half ashwagandha, and 1/8 or 1/10 of dry ginger powder. Yeah, this could be
Okay.
a good combination. Dr. Suraj?
Very good.
Definitely, definitely. We can make so many of a permutation and a combination with ashwagandha. So many herbs are there. We can make it and we can use.
Wonderful.
Perfect. Very exciting.
And so, is it like you said? It is again. It sounds like it's wonderful for everything, but it is definitely known as a brain tonic, an adaptogen. So, could you say something about why is it such a good brain tonic, and also it is known as an adaptogen? Is it correct the way I'm saying it?
Say it
Yeah,
again.
okay, Tripati.
Yeah, definitely. See, ashwagandha is a wonderful brain tonic. Uh, In Ayurveda, when we are talking about some very wonderful medicines to stimulate the memory, to stimulate the retention power of your brain, and to sometimes they are talking about dhi, dhriti, smriti, like that. They are talking up to the IQ levels of a person, how to enhance the IQ levels of a person. You might have seen a Hollywood movie, very famous, Lucy. Yeah. So in that movie, they have used a chemical to enhance the brain power to 100%. Like that also, if we are going in the field of herbs, okay, Like that also, there are so many herbs which can enhance your IQ levels. And among them, ashwagandha is one of the best herb known, best known herb. Yeah. In Medhya Dravyas, the herbs which are going to stimulate your memory. See, I'll tell you, when I was studying in 11th and 12th standard, some doctors have prescribed me ashwagandha so that I can retain all the physics and chemistry things which were slightly difficult at that time. So ashwagandha is definitely going to enhance the capacity of your brain. It is going to definitely, when you are boiling it with milk and taking, it will definitely make your brain very sattvic side. The sattva, raja, and tama, the very speedy nature of brain, the very lazy nature of brain, and the very positive and dynamic nature of brain. The ashwagandha will make your brain, make your all the hormones of your body, makes your endocrine system moves towards the positive and sattvic side of your life. Yeah, it is a sattvic herb. It has been used in yagyas. It is used in various rituals right from the, from the Vedic era. Ashwagandha is one of the oldest herb they used to offer to the gods, to the deities. Yeah, and then they'll be taking, consuming it. So it is having a very powerful natural energy also. Okay, so when you are taking ashwagandha, it will make your brain to move rather at the very positive angle. You will become a very positive person, just like Mr. Lal, who is taking ashwagandha every day. Yeah.
Yeah, but I like Dr. Trapati. I like the chocolate you showed me. I'm a
I'll
sweet
send you
person.
that.
I like sweets. So,
Okay.
We
so
will, don't
anytime
worry.
you want to, anytime
No,
you
no,
want to
no.
make,
We will put it in your mithais. Don't worry.
yeah, anytime you want to make a small factory or something like that, I want to be investor. Let's make
Thank you.
chocolate.
Thank you so much.
I used to make chocolate.
I would love to. I
Yes.
would love to.
Good.
Yeah.
So, I mean, yeah. One other thing. So, ashwagandha mixed with shatavari is okay, because I also know that shatavari, Dr. Sanjay tells me a lot that shatavari is a very good herb specifically for females. But then I am under the impression that ashwagandha is more male oriented and shatavari is more
No, no,
female
no,
oriented.
no, no, no,
Is that right?
No.
no,
It's
no,
not like that, ma'am. It's not like that. It's not only male oriented or female oriented.
no.
So it's depend upon the effect. The mainly Shatavari will having a effect on the female reproductive system. So that was the thing, and Ashwagandha also having the same benefits. Yeah, because we cannot only the Shatavari for female or Ashwagandha for a male.
So, a
We
female,
cannot.
I mean, if I want to take, I can take both ashwagandha and
Yes, yeah,
Of
sure. You can
course,
take a
of
both. Yeah,
course.
of course, you can take both.
I will not have an overdosage of power.
No. It's not like that, ma'am. It's not like that.
No, see, I sorry, I want to come and clarify this for the people. Uh, this the name Ashwagandha. Somehow people misinterpret. Okay, means ashwagandha, like the way, like as you say, the common like terminology, right? Like giving you a lot of power and all those kind. No, what we learned today, ashwagandha is like like in a simple language, it's
Thoughts.
a holistic herb,
Yeah.
right? It's like a multi-purpose herb. It's doing so many things. So ashwagandha cannot be seen as like a power or libido herb kind of things. That's like a devaluating the benefit of ashwagandha. Is ashwagandha is not for that. Ashwagandha is like overall, like that's what we learn, right? So that's
Yes,
established
yes.
first.
Yeah.
Once we establish this, there's no female or male. This is a very wrong concept. I don't know, like Veena, like you are with me. How come you like never ask me and then think like this is a very wrong
I mean, no,
perception you
why
bring
I'm
up,
saying,
right?
because I've seen certain bottles which says Mr. X and Miss X.
Yes.
For
No, no,
Mr. X, they put ashwagandha. Under Miss X, they put shatavari. So that's why I'm, you know.
no, no, that is a different thing. See, again, like both the doctors here, what they are saying, like in Ayurveda, you have a lot of the formulation, right? Lot of formulation. You can make any formulation. But when we are talking about single herb, right? Say ashwagandha right now today. So ashwagandha should not be tagged like it's a male herb. That's it, right?
Yes.
It can be.
Yeah.
But yes, Satavari can be tagged as a female herb, right? So this is very important because it is based on the evidence or the
Yes.
past track record or something like that.
Yes.
And
Yes.
we have a
Because
lot
of
of products
the
available these
practice.
days. Like if we go to like this Vedanath, Jhandu, Dabur, all these old people, those who promoted Ayurvedic things in India, there are a lot of products available. That's how the people understand. And I think one of the very popular product called, I believe it's called Safi, right?
Coffee,
I
coffee.
don't
It's
know which
actually it's a yeah,
brand
it's a
it's
blood
like, whether it is a
purifier.
Jandu or Vedana, something like. They have all this kind of stuff, so they claim like it's like the female health and like the blood purifications and all those kind of things.
Yeah,
So it's always
because
there.
of the marketing purpose, they are doing
Yeah,
all those
exactly,
things
exactly,
because they want to sell their the whichever
So
the
I have one
stuffs.
question here which is related to this and want to understand that in the market these days, you see like this Dabur's Arjuna wrist, right?
Yes.
So this, what is that Arjuna wrist? Like when we say, okay, like people understand, okay, we are taking the Arjun's chal or like Arjun or is a supplement or herb. But when it's a Arjuna wrist, is there any specific preparation or anything you want to say about it?
Actually, it's a specific preparation, sir. Actually, it's a older only.
Hmm.
So I think in the advertisement it comes new. It's like Jandu, sorry, Arjuna Arishta, Arjuna Sava, like that in the manner. It's a
Okay.
what happened. The medicine preparation in our Ayurveda, we're having the different kinds. Like we're having the main five, like we're having in a churna base,
Hmm.
or we can call it as paste base.
Hmm.
So and one other things we can use in a ghrita or a ghee base or oil base we can use, or we can use in a oil base. So sorry, in a fermentation base like asava aristas. So we can call it as nowadays. So we can compare with our this one wines and like sura, whichever in the
Okay.
older day we have mentioned in our Ayurveda that is sura. So wine base like that. What happened? We have to take the particular Arjuna and we are adding some other ingredients with that, and we have to tie or we have to made it into ferment for the particular period, and after that we are using for the medicinal purpose. So
So
the
you mean to say like,
fermented,
sorry,
yeah,
so you mean to say like in Arjuna wrist or any kind of wrist, we
yeah.
have ethyl alcohol a little bit inside it,
Yes, we cannot call it as completely ethyl alcohol,
but the
but we have,
combination is
yeah,
a
yes,
alcohol,
yes, yes, yeah,
okay,
yeah,
spirit.
combination of that,
Okay.
yeah. So we are making in that particular fermentation form, and we are using for the medicinal purpose. There's so many other medicines also we are having. We are making as a fermentation, and we are using for the particular diseases.
So for our audience, can we establish this fact like whenever people say wrist, it is a
Yes,
fermentation
yes, yes,
preparation?
yes,
Yeah.
sir. It's a
Okay.
fermented preparation.
See, what they are doing is they are taking herbs, and if they are boiling the decoction, preparing the decoction by boiling that thing and then keeping it to induce fermentation by adding some herbs like dhataki, or nowadays they are adding yeast also. And after 1 month they'll be filtering it, 1 or 2 months they'll be filtering it, and this is a self-generating alcohol preparation in Ayurveda. The older
Okay.
it is, the more potent it will become. The more, the dissociate, the more nanoparticle conversion will happen. That is what we believe. So
Yeah, the
aristas,
nanomedicines, same,
yeah,
the same thing we can follow here.
exactly.
Because the fermented, the molecule level will go on the in a nano size, and it will directly affect on a particular the organ or a particular site of the system. So that's what we're having the different type of preparations.
Okay.
In example, I can quote it as we are using the bhasma preparation. The
Yes.
bhasma is also the very nanoparticles we are using for the particular diseases. So same
Okay.
like that, the herbs also we are using in the manner of asavas or aristas or in a different forms of medicine.
Very
So
interesting.
Ayurveda is not only concentrated to only the churnas or powders. It's having a broad spectrum of the preparations with the different forms depending upon their usage.
Yeah. Great to know this. Great to know this. And I think like our audience will get benefit by um, understanding is this, because like most of the time it's a marketing language and people think like this is the different marketing name, but then it is a proper way of preparation. So what I understand here is if there is certain name in Ayurvedic medicine, it means it is prepared in certain way. Am I correct? Right? Okay.
You are correct.
Thank
You
you.
are correct.
So, I mean, Dr. Sanju, just for the benefit of the audience, could you explain, because there's so much ashwagandha in the market,
Hmm.
they value at different prices, and are there different grades available? Are some more therapeutic, or some just for generic health, or how does one differentiate or buy or make choices when it comes to purchasing?
Yeah, see what is happening here when we are hearing Dr. Tripathi and Dr. Suraj, we are hearing a pure Ayurvedic preparation, right? With the Ayurvedic science. So let's understand this. What is available in the market, these people or manufacturer may not have even a slightest idea of Ayurveda preparation or something like that. So they heard like, okay, ashwagandha is good, so they bring the ashwagandha and then it's just like farming kind of things, grind it and put in a capsule or tablet and sell it or in a powder. Therefore it is very important because if I talk about ashwagandha, this is my personal experience, and Dr. Tripathi, you will agree with me. Dr. Suraj, you are from a different part of India, very close to Jabalpur, the place called Amarkantak. And Amarkantak is known as a heaven of medicinal plant. And I myself have seen like ashwagandha growing in a wild. Okay, so there's no formal cultivation, but people go in the wild and they just pick up ashwagandha. So sometime if the people, those who are not very much knowledgeable for the type of the plant, they go into the wild, they pick up ashwagandha, but they may pick up like so many other stuff too. And when they come back to the laboratory, they grind everything, so that's where your ashwagandha is not pure. So though you think mentally it's ashwagandha, but your whole preparation and the supply chain is not taken care of, whether it is a pure ashwagandha and all that. So that's the first part. So that's a lot of impurities, like there's a lot of other herbs plus ashwagandha. So that's the first thing. Second is like when you do the preparation, like when you do the extraction, like how clean your lab is or the factory is, like the further is the packaging, the capsule, which kind of capsule you are using, if you are making a tablet, what kind of preservatives and other things you are doing. So basically this is a lot of deviation from the natural Ayurvedic preparation what we have learned today. So yes, I think like if we want to take a pure uh, ashwagandha extract in a capsule format, means I would suggest it has to be a capsule format, because inside there is a pure powder of ashwagandha. So you open the capsule and you use the powder. It's a multi-purpose. So who want to use the capsule, you can pick up, you can like take the capsule, and who doesn't want, open the capsule, use the powder, so you have a dose also, right? The capsule has to be the vegetarian capsule, because there's like a lot of gelatin capsule is there, and the people should know like the gelatin capsule is made from the cow bones and all that kind of thing. So this is a very important to know that, like the manufacturing of the capsule, right? So these days, like if you really want to be like a vegetarian or vegan people, you just need to be stay with like this vegetarian capsule, which is a very high grade good quality things. Third come down to like efficacy and potency, right? So that's the in a biotechnology or in a supplement market or nutraceutical market, what we say, if ashwagandha or any other thing is coming, so they have their own way to test this. In Ayurveda they have their own way to test it. So if it is sold in a market just as a supplement, we also look into the efficacy and the potency of it. So these are the certain points. And then the more important is the food safety. The food safety in the sense like whether it is a pure ashwagandha or it should not have any kind of like allergic products with it. So the purity is very important and the safety is very important. So this is from like the marketing and sales perspective, not from the Ayurveda perspective, because Ayurveda perspective, you heard, you need to take under doctor supervision. Doctor will advise you. They will go through like your health problem, and based on your health problem, they will advise you. But here we are talking like as a common public, if they want to use ashwagandha. So in India, they are asking like, okay, you can use the ashwagandha powder. But again, if you take ashwagandha powder, you have to make sure like how pure it is and all those kind of things. So it is always remain the quality issue. But as far as the international market is concerned, that yes, that whatever the point I said, it is very important. So by just looking a beautiful packaging and beautiful Ayurveda design and ashwagandha, it's not enough. So the client has to be very aware about it, that don't go by the look of the product and the beautiful Indian design and Ayurveda design kind of thing. There's a lot more to learn and to understand about the quality, right?
Yeah. So thank you so much, Dr. Sanjay. So that's exactly what Naveda follows, is that we make sure that everything is quality control, quality assured, and we have in-house scientists to make sure that that kind of quality is maintained at Naveda Integral Wellness. So thank you so much. So Mr. Lal, I believe also, what is this the secret to your? Would you like to give 1 minute? What's your secret to your longevity and your youthfulness?
Yes, ashwagandha. That's what we have been talking about, and
Yes.
especially Dr. Tripathi was talking about chocolates. I like chocolate with ashwagandha.
Yeah.
Anyway,
So-
I've been taking ashwagandha very regularly, for last nearly two years, and I enjoy. It has improved my memory. It gives me energy. It gives me calm, relaxation, and makes me sleep better like baby. I've been taking this for quite some time and I will continue taking. So this is what I'm taking, ashwagandha. See? Right?
Dr. Tripathi, this ashwagandha is made in MP, a place called
Okay.
Babai.
Yeah. So
Okay. That's
you
wonderful.
approve, Dr. Trapati, you approve this?
Yes, yes. This is a wonderful,
Yes.
wonderful thing.
I've
Yeah,
been
must
taking
take it.
this
Everybody should take it. Yeah.
every day, without fail. I've been taking this. Right.
Yeah.
Thank you.
So this is one of his secrets to his youthfulness and his energetic way of
Yes,
being.
Dr. Kumbar, did you see it? You were not there when I showed.
Yeah, you can check, sir. You can check, sir. No issues, sir.
So you approve this?
Yeah, sure,
Taking
sure.
this? I've been taking this, but
Sure,
nowadays
sure.
I will start taking chocolates also. Chocolate. Also.
Yeah. Sure. Tripathi ji will send by you a courier or some other way.
No, with all the recipes that you all have shared, we'll make one for him, not to worry. So thank you once again for being in this panel discussion. It has definitely been very enlightening, and I'm sure our audience has learned a lot. And if anyone wants to find wonderful ashwagandha in Hong Kong, please do come to Naveda Integral Wellness Center. We do have the best quality available here. So thank you for sharing your knowledge. We will come back next week, same time, same place, and we will be discussing about Brahmi next week.
And I have something to say. If anyone want to find a good Ayurveda doctor,
Doctors,
like in
yes.
India, like Dr. Tripathi is there and Dr. Suraj is over there, like means
Yes.
you can always, because the whole idea here is people need to know that the people exist. Okay. More people, because like there's a big trend, and I believe it strongly, like next 5 years you will see Ayurveda trend will take up very much. So yes, thank you very much.
Yes,
Like we should.
Thank
Thank you
you.
so much.
So yes, thank you so much, and we look forward. Hopefully, if you all are available next week, we'll be in touch with you.
Thank you. Good night.
Thank you. Good
Thank you
night.
so much.
Bye-bye. Bye-bye.